Stop it. If you have a horror story about debonding a fixed appliance with 3D printed bands, come talk to me. You're just making your life a lot harder and you're making my life a lot harder. A doctor who started using me a couple months ago, a friend, um, has inserted a few dozen fixed appliances now. And he hasn't done a debond yet. So he was at the AAO, started to hear a couple horror stories here and there, and then I get a text. And I'm like, we already did discuss this. And he was like, yeah, but now I'm hearing this and I'm hearing that. So I went and I polled the other doctors that I worked with. Now, keep in mind that the different bands are that the different labs use different bands and there are different protocols. This doctor and the other doctors that I polled are using my bands and my bonding protocol. So I polled them, and this is what I got. Uh, I'm going to read straight from their actual quotes from texts that I got back from them. The bonding experience is so simple. No spacers, band always fits perfect, easy to cement, smooth to the feel. Fit is perfect. Digital banded appliance fit and grip teeth ideally with little or no need for a bite stick or band reshaping. Bonding tip. Try to leave the occlusal free of cement for easy removal, gauze and microbrush to clean excess. Debonding. This is the important one. They pop right out with ease, so much easier for patients. Bonding is very easy, fits most of the time. When it doesn't fit, they need time to alter. Usually cusp of carabelli area needs to be carved out. Need to be more careful about detail when band does not go all the way to the gingiva. Need better brushing or put a seal in around it. Much easier on patient. No separators needed, so one less appointment. Debonding is a little harder, so I put bands on sixes majority of time. Need more pressure to get off. Debonding is harder. Benefits outweigh this for me. So I sent these to him. He felt a little bit better about it. And then about a week ago, he did his first actual debond. He hasn't gotten back to me yet, but his assistant did. And she said, and I quote, "It was a breeze, so no worries." Now, this office, not only are they using my bands and my bonding protocol, they also use the debonding lugs. Um, and the assistant noted that the lugs made it beyond easy to remove the expander. So if you have a horror story or if you hear a horror story, come and talk to me about it because a lot of it has to do with the bands that you use, the bonding protocol that you use. I've seen a bunch of different bonding protocols and I've read the various articles on the 3D printed bands. Mine's are different. My bonding protocol is different. There are no horror stories. It's just easier on the patient, it's easier on you, and it saves a lot of time. Now, other questions that I've gotten from doctors, they seem to be a bit confused, I guess, about like what they can expect. Uh, like the one doctor said that he couldn't switch to the 3D bands because he needs the attachments. We have a full attachment library. Anything that you can get on a pre-made band, we can put on a bonded band. I mean, a 3D printed band. It's really just what we used to do. It's all going back to 40 years ago, before pre-made bands, when we made all the bands ourselves and would weld the attachments on. So, but I'll be covering that in my next video, the history, a brief history of orthodontic labs. But basically, if you have a question, just come and talk to me. Click on the link, follow me on YouTube, follow my Facebook page, follow my website. If you have a question about anything having to do with orthodontic labs, write to me and I'll answer as best as I can. Because what I found is the doctor experience is can be very limited. Whereas my experience, I got over 35 years at this. I've dealt with hundreds of doctors. I'm dealing with more now. I've spoken with dozens of labs. I've been at the AAO. I've had the conversations with the doctors and other lab owners. I've been at various meetings. And my experience and my expertise is at your disposal. I really need to write a book about this. But then anyway, stop the horror stories. It's a myth. Well, it's not a myth. I can't say it's a myth because I'm sure that you did have a horrible experience, but you didn't have to have one. Just come talk to me. I'm always here. Have a good one. Have a good weekend. Aloha.